on September 25th, so I'll call the meeting of the Ayer Board of Health to order. The chair is out of state on business. That is why she's not here tonight. So, we have nobody here from public input. We already had approved the minutes of the 28th last time with corrections. We just signed those, so that is fine. We had no minutes from September 11th?
No. I've been moving the office, so that's kind of taken up a lot of my energy. And I told Pam I probably wasn't going to get the minutes done.
Okay.
And I didn't.
All right. So, I would, first of all, our health agent, Bridget Braley, did call me. She knew that Pam was going to be out of state on business, so she called me today to say that at 8:45 last night she was out at Nasoya. So she got into our office, I believe she said, a little later. She was out doing inspections. She did call me about 2:45, said she had got back to their office on Central Avenue and was going to look and see if she had received anything from Michelle Delmore, and she had to do some more inspections. She said that her probably wasn't complete what she had here because, and I had told Pam about this last Wednesday when Jim Gariffi called me to see about a date for our quarterly meeting. I thought we might not be having one because we had a late one. And he said, no, he was keeping to the minutes. And that is when he got this from about the mosquitoes, the West Nile virus. So he said, how should I handle this? And I said, well, email it over to the office and they can get something out, because it was late in the day. It was probably about after 3 o'clock at that time. And then I said, we can go from there. So he said, oh, okay, that he would do that, and I believe he did. So then I notified Pam about that, and I also told her that somebody rang my doorbell to tell me they had a problem with rats up on their property. They had somebody from pest control come, and he put some traps and said, it's coming from the neighbor behind you. So I said to the person, okay, I'm going to call Bridget. You going to be home? Yes. I said, well, then don't leave. I'll get a hold of her, and she's going to want to come up, and she'll bring her camera. No, that's fine. So she did all that, and she said, in fact, she didn't see anything from the neighbor behind, but what she did see was one of the other neighbors had chickens in his yard. No permit on that. So Bridget emailed that to Collie Purdy so that she could go see, and then we'll follow up from there. So I let Pam know that there was no trash that could have caused all these rats. However, because if somebody's just got chickens, I don't know how many. She just said, I'm going up, and I'll try to get a hold of you later, and that was late on a Friday. So that's the follow-up on that.
Mary, do you have the address for that? Because I haven't heard about that.
No, I don't. I don't have the address per se. Like I said, it was.
When was it?
It was
I mean, I heard about the chickens, but I don't think I heard about the rats, but.
Well,
I
if
haven't
you heard
gotten
about the
anything.
chickens, then you heard about the rats,
Oh, okay.
because
Okay.
the two were connected.
Okay,
So we'll hear
all right.
from something with
Okay,
with
maybe I
Bridget.
did, okay.
So, let's see. I don't know what this is. Oh, I think we've got several things here, probably doesn't have anything to do with us, but, we get these forms, how they come through for new projects, so this one, and I know they were having zoning meetings on, this had come through, and they've already had the public hearing on this. This was from some zoning variances for the old fire station.
Oh,
And all of these are already through.
Yeah, she just left those for me today, so
Yeah.
that's why I put them in.
Yep. So, another was for Pierce Avenue down there. So these are all, I think they had this
They've already
last
met
week. Yes,
on all
yeah,
this, okay.
yeah. So. And actually, I think, and Bridget had mentioned this before now, we really don't need to name every single place. For example, if she got a routine inspection on something, we don't need to be naming it.
naming it at meetings? I mean,
Correct,
if
because it's
routine,
nothing.
Right,
If we have a problem, as we did
with certain,
with a certain place, and she,
Yeah.
finds a lot and says, this is what I'm doing, okay, I'm going back. Because if you think about it, before the end of October, she'll be doing all the food renewals.
okay,
That's a ton of them.
yeah,
It's a ton.
so,
unless there's, for example, I think if somebody drops out and doesn't renew their food license, we might mention that to say, oh, by the way, if you go here to eat, they haven't renewed, they must be closing or changing hands.
something that's pertinent to
Something
what,
too pertinent.
Yeah.
Yes, yeah,
that makes sense.
yeah. So this was, and she told me this was that chuck wagon. You know who, Chuck, yeah, I think, yes, that's what he calls it, from Fresh Air Sports, and he has a sausage wagon and stuff like that. Well, she had viewed it and didn't like it and closed him down and said, you need to do X, Y, Z.
So is that the one that I mentioned at the last
Yes.
meeting, and we didn't have any knowledge
Correct.
of it? Okay.
Correct.
God, I said, you must have, he's out there.
All right.
Okay.
Yeah. So she had closed him down because he had quite a lot of, he had somebody cooking that didn't have a food permit, no hand wash set up, no 3-basin sink, employee didn't have a handed on, person on duty did not have allergy or food manager certificate. She told me that she had since gone back there and she followed up, and that she did give him permission last week to open. So that,
Yeah, it wasn't a big, I remember it was just a little bit of a thing, so to have all of what you need to,
well,
To,
no, it's
well, I mean, compared to some of the other big wagon setups that
Yeah,
you see.
yeah. So that's pretty much what I've heard from her this week. As I said, the big thing is, again, Nurse Sawyer, she'll let us know. I also asked her to follow up. I think at the last meeting, we had a complaint, or many complaints. I believe the address was 25 Columbia Street about trash. She said she's working, the owner lives out of state. She had contacted him, she's working with him, so it is getting cleaned up. So I think that was the majority of what we had. Do you recall anything else that we were following up on?
No, no, I do remember that conversation though, and that's how we left it. We were looking at it. I remember we were looking at it to see exactly where it was, but.
Right. But see, sometimes people call and they think, number one, I often think that people think that the office is open maybe on the second shift or early in the morning, and you have to allow time. Somebody doesn't just run right over. They all have their routine where they go. And, Bridget has a routine too, and she goes out and then she has to check to see who owns it, because a lot of times the owners are out of town, and this one was out of state, in New Hampshire somewhere, I believe.
Right.
So she's satisfied that that's being worked on. And I haven't heard any more. There was, I think, something on Willard Street, if I remember. There's nothing here, so I'm sure we'll have that follow-up in the next one.
Okay.
So, I think the next is you, Tricia.
Yeah. Yes, and I had spoken to Jane about getting this up and running. I did manage to have a conversation via text, private message with Marianne Prince, who is she's the head of it. It's the core group in Shirley.
Okay.
And I found out that SHARP stands for Societal Heroin Addiction Awareness Resource project. And the reason, other than wanting to, get them on board too, was I had heard that they were thinking of doing something early in the school year. It's more for, most of these women have lost a child. And I talked to her about, we had a lot in common. I told her that Board of Health was behind it. A lot of it, we've been talking about it a lot at our meetings, and I didn't know how much conversation they had with the Board of Health in Shirley. She didn't respond about that. Unfortunately, she's in the hospital. She had a knee replacement, blah, 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 all this other stuff. But I said, what do you think? And I said, our administrative assistant is having a conversation with Dr. Malone, because you're going to be up doing your taping.
Right, very shortly. I'm not sure that this week, but
yeah.
very
And
shortly.
I asked her what she thought about a date, and she said they were thinking November also, which would give us more time, because I did hear back from Mike Dugan, who used to be with Wicked Sober. He was one of the speakers at the last forum they had in Shirley. He's now merged with Recovery Centers of America. And I found his number. I texted thinking that he must not have the same number. And he got back to me, and he said, you let me know what you need and when you need it. So I'm going to be in touch with him too.
Good.
And Marianne Prince said something about Nikki Songus, but I was a little bit confused, because Nikki Songus, isn't she not running again? She's going to be done.
Well, next
year.
She's
but
still
that's
the
okay.
rep.
She's-
But we had Jamie Eldridge at the last one, and he was really good. He answered a lot of questions, and I thought, I'll let Marianne handle
Well,
that.
the reason why Nikki Songus would be good is because a lot of the grant money is coming from the federal level, and this is a national problem. It's not just a state problem.
Right.
So she would have the perspective of what Washington is doing.
Oh, we definitely need somebody there, a
Yeah.
legislator.
And it's affecting everything. It's, you know, there are certain areas. I mean, it's an emergency. What is it? Every month we're losing more people than we lost at 9/11.
Do you know why I'm flustered coming in here tonight on 2 wheels? I just came from a wake of someone 24 years old.
Mm-hmm.
Right.
Same thing.
Yeah.
Well, maybe.
Keeps happening.
Well, yes. Drugs are so prevalent out there today. In fact, I was reading a good article and I saved it for nurses that are becoming addicted. And how many there are in Massachusetts. And there is one who, and it's a 5-year program you have to go through in order to not lose your license.
Oh, so they're not taking the license?
Well, and you know, that's way back, you know, in the dark ages when I was actively working, it was a case of when you knew somebody, a nurse was using drugs,
That's it.
they were out of there, they lost their license, and I don't know what you know, they move on and you don't find out what they had to do to get it back. But now when you think about it, it's so high stressed there. And they said in the article that what happens is it's, okay, we have a little shot of morphine to take the edge off. You're in the emergency room. It's stressful. You have all these people screaming and yelling at you, and it's a high-stress job. And then it becomes another dose, and then maybe some Dilaudid to smooth things out. And the man that now works as a counselor, he went through the program and they offered his job back, and he said no, that would be too much of a temptation. I work like heck. He had all these stresses in his life. He was raising children on his own, and he said no, I'm going to work now to help others.
And that's what you're seeing. A lot of these people that are in recovery are turning it around. Like, and Kate Duffy also said to me, she's the other woman that has her own tipping point recovery. She now is certified to train people to be recovery coaches. And we had talked about this at the last meeting. And her group is growing. People that either know someone or used to be one or whatever, they're signing on for this. So I think we're going to have enough people. It's just getting the date. So
we need to get the date, and and I'm a little late in getting my show off the ground because they've had some issues at the studio. So, but this I don't think we're going to have at the studio, and I think we'll have it, either at the auditorium at the high school or here upstairs. So that won't be an issue. And I was thinking about the timing. So I think late October or early November would be good.
And Mary Ann had said they were shooting for November with her group. So if we can take the people that she had contact with and merge with a few people that we have thought about, like Chief Murray. I would like to reach out to Neshoba Hospital and see if they have someone that...
You know who else I thought would be good is get somebody from CVS, from the pharmacy, maybe the pharmacist or something.
Yes, because they could speak to the Narcan and the cards.
Yeah, because CVS has taken a very aggressive stance.
Yeah, I saw that, but I didn't know how accurate that was, where they could check on how many refills and call the doctor and make sure that this is accurate. Did you really mean to write it for 60? Didn't you just mean like 10 post-surgery? Something like that. So, yeah, that would be a good
Yeah,
resource
Well,
too.
if you're going to coordinate this with so many other groups, I think it's obvious you need the high school auditorium. I mean, up here when we had the Limelight one, that was a different thing, but we still had pretty much every seat filled up there. So now where this is so prevalent everywhere, and you can't pick up the paper any day without reading something about it.
Yeah.
And it's cutting across
It
socioeconomic
does.
lines,
Yeah.
it's
Yeah.
cutting
Doesn't matter.
Like you
across
said, the nurses,
ages.
the professional people.
Yeah.
Yeah.
And the most tragic of all are the children who are dying, or children who are being born addicted. But there are children, you know, babies that get into their parents or their grandparents' medications, and you know they're seeing an uptick in that, and it's just on and on and on.
It is.
It's horrible.
I think this time, though, you know, the last one that I attended, it was more people would get up and speak to give you their story. I'd like to have like different. Well, now this is 2 years later, so much more has happened. We didn't know you could go get a prescription for Narcan. You didn't know that if the EMTs came and revived you, if there was paraphernalia there, you're not going to get charged. They're going to bring you back, and then they're going to work with you. I think that's a big scare for a lot of these people that overdose. Then they don't call for help because they figure the cops are going to come, we're all going to get arrested. And it'd be great to have Chief Murray speak to the legal part of it.
Yeah.
And
Well,
the
I
insurance
think,
and things.
Trish, it would be helpful if you and I had an opportunity to sit down and actually make a definitive list
Yep.
of who we want to get,
Mhm.
and then we'll set about setting a date and getting it on the agenda.
Yeah,
Keep in mind though, if you have too many different speakers,
right.
they'll each have about 5 or 6
Yeah.
minutes, because there's going to be people that have the problem.
Right.
You want them to be able to ask a question and get an answer,
Yeah.
but they won't be able to if you have
Too many.
like 10 or 12
Right.
people.
And I think that's it was so well done that time that I went to the middle school in Shirley. I think that they had looked at that, Mary, because they had like maybe 7 people on the stage. They spoke quickly, concisely, said what they needed to say, and then there were 2 microphones, just like at a town meeting,
So
where people got up. And they
Yep.
only had so much time. And I think it was Sharon Webb, who was the counselor from the school. She moved it along and said, okay, next. You know, somebody that's like a moderator to keep it moving.
Yeah.
But you're right, you can't have too many. And how many sad stories you could listen to them all night. They're all very different and they break your heart. But I think you only need a few people that really hit home with their recovery story.
But you know, it's such a holistic problem because it touches on employment opportunities. It touches on the warriors coming back from Afghanistan. It touches on the pharmaceutical companies. It touches on our medical modalities and what we're doing with people for pain. It touches on why people have so much chronic pain. I mean, that's really an interesting question because that seems to be an uptick. You know, and what's causing all that pain, and you know. So anyway, it's a multifaceted
But
problem.
again, you have to kind of boil it down to what you want to do that night. And again, if you revive them, you treat them, you say you're not going to be arrested, and they just do the same thing again, how many times can you do that? You know, do you need kind of a sober house around? Someplace, and if it's the environment they're in, you got to get them out of that environment, and where can they go?
That's why
right.
that Florida story is so big all the time,
Yeah.
trying to get them out of state.
Yeah, and there's a lot of fraud involved with these,
Yeah, we saw
you
that.
know,
Yeah.
Yes.
with treatment facilities. You know, there's a big business going on, but how much of it is legit and how much of it is,
Right.
you know, on the take? So,
A lot to consider.
Yeah.
So we're shooting for no. I would say I would say we have to get on that
That has to
The
be the
date
first
first.
thing,
Yeah.
is get your date,
and then
And then-
contact
Yeah,
call your people and say, can you come?
on that date.
Yeah.
And then decide what you're going to do.
I'll see if I can talk to Dr. Malone tomorrow and see what the availability is of the auditorium.
Now, will that be, I know down here, we have our own taping going on. Will that be possible to tape it up there? So it would get on the cable access?
Yeah.
Oh, sure,
Oh, yeah.
of course,
Yeah.
of course.
Yeah.
Oh,
Just
yeah.
like town meeting, anything
Yeah.
else? Yeah.
Yeah.
Because some people can't get
Right,
can't
right,
make it. Yeah.
right.
Okay, because I do need to let, I know my two people that I really want there are Kate Duffy and Mike. And they need to know ahead of time because they're really, and we also need to find out if Chief Murray or someone from the hospital. If we give them the date and then maybe they can work around it.
Yeah.
I also wonder when I do talk to Mary Ann Princey, and I think I'll ask her who's on the Board of Health and Shirley and if they have had any conversations. I'm just curious, are other towns having these conversations at the?
Well, I think I told you, I asked
Yeah,
Jim
Jim.
if they were doing anything per se,
Right,
and they don't have the staff
right,
to do that. And he told me, he said, if you're looking for grants, they're few and far between.
yeah, that was, we knew that,
Yeah.
yeah, I just,
And in order to write a grant, you have to have somebody that knows it, and then you're taking, we don't have a grant writer per se
right.
at Children.
Well, I've been just reading casually, but it sounds to me like the federal government is pumping a lot of money into the grant world for stuff. So that kind of surprises me that there's not much available, because the Center for Disease Control and the NIH National Institute of Health, both, it's very prominent on their radar. So I'm kind of surprised at, that there isn't any money available, grant money. But, there's probably a lot of competition.
And there's a lot of, and it's different, but like, they had a motorcycle ride last week and the weekend before. They
Yeah.
were raising money for the vets
Yes?
for a place on Devon's, but it was a non-medical facility. And you
Yes.
think of all the places up there, and you think of the need for sober houses or halfway houses. And, some people gripe, oh, I don't want that in my town, I don't want that in my neighborhood. But Devon's would be, it seems to me, it'd be, if they had the availability in the buildings. I mean, these guys are raising money to put the vets up there in vacant buildings. I'm positive it wasn't just for, to raise money to build something. I don't think you could get that kind of money.
Okay, so you're working on that.
Yep. We'll work on
All
it.
right. Now,
What's a good time to talk to you? When do you get out of school?
I don't get home till after 4.
Okay,
My busy night is Wednesdays. So
Okay.
any other, yeah,
okay,
we'll share.
okay,
Yeah,
yep.
gotta do that. And I'm gonna get back to Mary Ann when she gets out of the hospital and talk about
Yes.
lunch.
Yeah.
Good.
So, okay, basically on this, if you've been following the news, we're going to do, excuse me, up at the landfill, some solar. That's what all this is about, just where and how it's going. And this was briefly mentioned about MDAR going up
Yep.
to Ruth's property. And then we got this notification, in fact, it was on my door, about them doing the sewer department, the catch basin Did you get it on your door? I got a notice that says, they will be smoke testing specific areas of the sewer collection system
Yeah, I
as part of its infiltration and inflow program. Residents and businesses within the testing areas will receive notification prior to testing in their area. Excuse me, the testing is planned to start on Monday the 25th and expected to be completed by Friday. You don't have to be home or anything, they're just, but they did
Yeah, I
notice.
saw the notice on the
Yeah.
town, the Facebook post.
Yeah. And then there's just some information here on the mosquito that tested. And then, let's see. What is this? Oh, this is, what all this stuff is. I don't know why we even have this. It's,
Well, they want, if it's what I think it is, the town is asking everyone to do, to look over the descriptions of position descriptions. You know, for
Oh.
me,
Yeah,
yeah, like, you know, what my duties are and stuff.
we updated that. We changed hours, probably, we updated hours before anybody else or after others.
I didn't see it, but,
We updated hours,
do you have a copy, do you know when?
yeah, I'm thinking right now. And it was probably, might have been after Michelle left. Because we had piles, we got job descriptions from many different towns and looked it over.
Well, I did, you know, early when the union was looking at all this, I threw together something about what my duties were, and that's attached to that.
to this.
But I didn't find, I know that you've done it, but I couldn't lay my hands on it. So,
This one.
yeah. But I just did that off the top of my head, so it's probably not complete.
No, I think ours was, I'm trying to think if it was done just around the time that Town Hall unionized. But we did it because we felt we had some things that were specific to our area that the general job description was pretty blah, if you want to
Vague.
know the truth, very vague. So,
But anyway, I did take a stab at it, so there's a
well,
draft there.
we need to find the one that we put upstairs there, because
I don't have it. I mean, I couldn't find it.
it was in the file, so I don't know.
I don't know
haven't been
where.
in the office.
But,
It was always there.
Who did you share it with? Did you share it with the town administrator?
Yeah, would Robert or Carly have a copy?
Evidently not, or we would have gotten it attached to this.
Well, they weren't here. Well, Robert was here then.
But
No,
it's
he
time
wasn't.
to,
No, he wasn't. It was probably just before he came.
but that's a long time ago.
7 years.
Yeah, that's long.
But the basic duties have not
Yeah. Well,
changed that much. But we did do it, and it should be up there. So I don't go up there in the file, so it should be there.
all right. Well, it was before my time and I haven't seen it, so.
Any bills? No? No. Okay. Nothing else? You think that you would have more information for the meeting next Monday?
Probably. For the next, when's the next?
Next
Next
meeting is
Monday.
next
Do
Monday.
we want to meet
Remember,
next Monday?
because, huh?
Do we want to meet next Monday?
Absolutely we do, because October and May are the 2 months where due to town meeting and holidays,
Okay.
We meet on the 1st and 3rd.
I'll be having a conversation. I was.
Well, if not, you may have had some more
Yeah.
information.
I would. I would like to get a hold of someone at Neshoba
And what
and talk more with Shirley.
I can tell you is that last week at the selectmen's meeting, John Hillier was there from Compassionate Care. And you know how we talked about this whole new, the new law and the retail shops and what was going on in the state. We just said, we're not going to talk about cannabis anymore because we're tired of hearing about it. But when he came and he was with his legal firm, and what we found out is somebody that's doing the medical marijuana doesn't have to go through all that process that other people are. And he can open a retail shop because he's already doing the medical.
But there was something on the news about that the day after we had our meeting. That's when Milford, they were talking more about that.
That
And
doesn't
then, yeah.
apply to
No,
him because that's why I was like, wow, I hadn't read this anywhere. And he said he went through all that. We know that they can't get out of their own way as to what they're going to do.
Right.
You keep hearing, we're going to do this, we're going to do that. How many retail, they don't know. But, it's going to cost a lot of money to get this up and running. And what he wanted, I guess they want, I'm trying to think of what he called it, like a host agreement type thing with the Board of Selectmen. And this is what they're requiring now. Well, he went through the whole process when he opened that. I mean, he came to the Board of Health, he went to the Planning Board, he went to the Board of Selectmen, he had all kinds of open houses over there, and there's been not one complaint,
Right.
not one
He's
call
been
there.
Professional.
Not one call. They checked with the police and everything, not one call. So he has a place, he said he would name it, but if they sign this host agreement, then he's going to open a retail shop.
He has something.
Yes, yes. He's waiting to do this agreement with the Board of Selectmen before he gives the okay. You're not going to say, yes, I'll rent that, or yes, I'll buy that if you aren't going to get this. And this is apparently something that they now require places to do. But I was surprised to hear that when he said, I don't have to because I'm already in business.
Right.
So,
Well, originally, my understanding was of the statute after that vote was as of July 1st, 2017, if the state didn't have their act together, that the existing medical cannabis places could sell retail at that point.
well, originally they were supposed to start, it was supposed to go into effect in January of 2018, and our legislature pushed it off for 6 months. Well, now July 1st is kind of staring up there, so they've got to get their act together. But anyway, he has something, he said that, so we'll hear more. So, and I think the way, it's some, and I didn't write it down, but there's some way that how many retail stores you have depends on how many liquor stores you have, I guess, something like, it's like 20% of them.
Oh.
So in our case here, there would be only one.
How many liquor stores?
I don't know, I wasn't clear on that whole percentage thing. So I don't want to have somebody say, oh, she said it this, but it's a percentage of the licenses of those stores. It's 20% of those. So ours comes out anyway to 1. And he wants that one. Now, I'm sure that there's ways that the town could eventually vote for more. That would be something else. But right now, that's what he's asking for, and he has the place and he wants to, go forward with it. So we'll see. So that's all I know about that. So
Okay.
I don't think there's anything else.
No, I think
So we'll meet
this is October 2nd.
next Monday. Yep.
Any idea of what you want to put on the agenda? for
Well,
next week?
it looks as though it would be routine. We may or may not have some update on that. And
Yeah, I will have.
Yeah, and
probably a
that's-
few more names.
yes,
or
yes.
I will have
Yeah,
spoken with
maybe
you.
we can
Like
put
to
our
get-
heads together.
Yeah, really get the date first. Can't do
that you have to. You have to
Well,
do
I'll
that
call
first.
Dr. Malone tomorrow.
And well, it's getting time of the year too that we'll be getting the waste haulers out. I believe that either some of them have gone out of business or they've been taken over by another. Yeah, because you always recognize the color on certain trucks, and now you see and you say, oh, wait a minute, because it's got a different name on the side. So I
Right.
think they might have either merged, or they're not doing this part of the place anymore, but those have to be open.
Yeah.
So there's a lot going on.
Well,
So-
the other thing that probably belongs on next week's agenda, now that I'm thinking about it, typically, the first meeting in October, we set the fees
Oh,
for trash haulers
Yeah.
and for tobacco. And we can have that discussion as to whether we want them to stay the same or we want to change them. So I'll put that on the agenda.
Yep. And I don't think we've had anybody that we've had to fine, to my knowledge.
Yeah, it went very well last year.
Yeah.
Yeah, very smoothly.
Okay then, so if there's nothing else, I'll entertain a motion.
I move that we adjourn. 6:14 p.m.
All right, I'll second. All in favor, say aye.